Thank you. Good afternoon. I'm going to do something different today. I decided to bring in some applied psychophysiology, specifically heart rate variability. And it's interesting because my friend Paul Lehrer, who was a major figure in developing heart rate variability biofeedback as a training modality in North America, also took his physiological recording equipment to Japan to several Zen centers and monitored the breathing of Zen monks and found a number of parallels between heart rate variability breathing as we train it in biofeedback and what the monks do spontaneously in their sitting practice. Today, I'm going to talk about heart rate variability first as a biological phenomenon that is always there. Our heart rate is always varying, but it's also a wellness practice that can be taught. So first of all, what is heart rate variability? Heart rate variability refers to the moment-to-moment change in the time intervals between adjacent heartbeats. This screen is showing an EKG with the prominent R wave spikes labeled as R1, R2, and R3, and the time interval between those spikes should be constantly varying. A healthy heart is not a metronome. Healthy, resilient biological systems always have large oscillations, changes. When the heart loses its variability, there's a higher risk for illness and death. In fact, many illnesses cause a loss of variability, which contributes to the impact of the disease on the total organism. When we train larger variability, we actually can increase resilience, health, and optimal performance. Now, heart rate variability is an emergent property caused by multiple interdependent regulatory systems which operate on different timescales. When we have high variability, we adapt better to the environment, to stressful events, and to psychological challenges. Breathing and our autonomic nervous system are the major contributors to heart rate oscillations, and we can use breath training as a core component in heart rate variability training. Now, I've had patients ask me, well, what difference does it make? My heart rate goes up and down, who cares? Well, there is a lot of good medical research showing loss of adaptation, a greater risk for illness and greater risk for death when heart rate variability is smaller. Research came out medically in the 1970s showing that lower heart rate variability accompanies and sometimes even precedes the onset of many illnesses and health problems. Since the late 1980s, heart rate variability training has been shown to be an effective intervention to moderate many of these health problems, in some cases even reverse health problems. So we associate low heart rate variability with sadness, trauma, depression, stress, aging, diabetes, post-traumatic stress, anxiety disorders. Wolf, studying patients with myocardial infarction in Australia, found 73 of 176 patients admitted to a cardiac care unit had larger heart rate oscillations in sync with their breathing. These patients had lower in-hospital mortality. A study in 1987 by Kleiger et al. Followed patients with heart disease, and Kleiger grouped these people into strata, people with less than 50 milliseconds of heart rate variability using an index called the SDNN, or standard deviation of this interval between heartbeats. If you were below 50 milliseconds, you clearly had poor health. If you were between 50 and 100 milliseconds, your health was compromised. And if you were in that highest group above 100 milliseconds, you have good health. And interestingly and importantly, patients in that highest group above 100 milliseconds had a 5.3 times lower mortality risk than patients in the lowest group. Now, the classifications I've just given you are based on long-term monitoring, a Holter monitor, 24-hour monitor, not the 5-minute monitors we usually do in biofeedback. So the categories have somewhat different numbers. Lower heart rate variability is a useful predictor for sudden cardiac death, but it's also an indicator of compromised health in the general population, even people who do not have heart disease. Now, at the other end of the spectrum, high heart rate variability, we find evidence of resilience and adaptive capacity. High variability is a marker for good health, resilience, adaptation in any biological organism, not just the human. We associate it with optimal performance, self-regulation, resonance, the resonance of a number of physiological systems with each other, general wellness, social engagement, social affiliation, and connection. Heart rate variability is widely used by sports trainers, executive coaches, optimal performance coaches to optimize sport and performing arts performance. Today, there are many apps for heart rate variability, so many laypersons are using it for self-help and self-care. Many healthcare professionals are now using heart rate variability training to reduce symptoms of anxiety, depression, PTSD, chronic pain, irritable bowel, and many other conditions. If you were to go into a clinical biofeedback training, the initial phase would be an assessment to identify your resonance frequency. That's the breath rate for you, which produces the greatest heart rate variability. You would go through a process while you're monitored with an EKG, a respirometer, or a blood volume pulse sensor. And you would breathe at different breath rates, and the therapist would identify which breathing rate was best for you. And from that point, you would practice paced breathing at your own personal resonance frequency breathing rate. However, we can also help the average person increase their heart rate variability by having them breathe at an average of 6 breaths per minute, because 6 breaths per minute is the average across multiple individuals of where the resonance frequency usually is. With each inhalation, the sympathetic nervous system activates and our heart rate increases. With each exhalation, the parasympathetic nervous system becomes dominant and heart rate slows. With paced, smooth breathing, the autonomic nervous system re-regulates and balance is restored. So I'm going to guide you now in breathing at heart rate variability, average resonance frequency, 6 breaths a minute. And I will use a breath pacer, which is available online from the Biofeedback Federation of Europe, but there are many breath pacers. Ideally, you would use one which is programmable, so you could adjust the breathing rate. You could also increase or decrease the length of the inhale and the exhale, or introduce a pause in the breathing. So I'm going to stop my share and bring a breath app onto my screen, start it, and get rid of the sound. Okay, and now I'm going to share my screen again. Can you see the breath pacer? Can somebody unmute and let me know whether you can see the breath pacer?
Yes.
Yes.
Is that a yes?
Yes.
Okay, thank you. All right, I'm going to invite each of you now to get comfortable in your chairs. I'm going to further decrease the sound. Somebody let me know if the sound is annoying. I'm going to ask you to begin to breathe gently and smoothly, breathing in when the white ball goes up the hill, pausing at the top when the ball pauses, and then breathing out as the ball goes down the hill. So you're going to breathe in now, pause, and exhale. And this is set for 6 breaths a minute. I hope that that's comfortable for each of you, since many of you do some kind of breath meditation at one time or another, or yoga, it probably will be. But I'm going to invite you to stay with that ball, breathing gently, breathing in a relaxed fashion, continuing to breathe in, pause, exhale, pause. For most people, it's optimal to breathe in through the nose and out through pursed lips. Pursing our lips makes us just slightly more aware of that out breath and also slows the out breath somewhat. Many meditators will find that this feels a little fast. Anyone who hyperventilates in everyday life will find this a little slow, but it's a good compromise rate of breathing, which will enhance enlarge heart rate oscillations for most people. And now let's stay with that for 4 minutes. Breathing gently, breathing smoothly. Exhaling with the ball. Pausing, inhaling. And notice the impact on you, your body, your emotions, your mental state. Continuing to breathe gently, smoothly, and mindfully wrapping your awareness around the process of breathing. It often feels a little strange initially to breathe with something external as our guide. The goal is for this to become spontaneous, automatic, such that I don't need a breath pacer, but I can breathe at my own optimal resonance frequency day after day, practicing whenever I have a down moment, practicing my resonance frequency, which has an impact on my physiology throughout the rest of the day and on my emotions and on my heart. Going to go another 30 seconds. Okay, I've stopped this screen sharing and hopefully you can unmute. I'm just curious. This was a very short experiential exercise, but I'd be curious any reactions or any response to that.